Thank you, Mr. Chair. I'm here for House Bill 613. This is it's a real simple bill. It's not complicated. Basically, all it does is change the name of our Department of Health and Mental Hygiene to the Department of Health. And people are going to say, this is a little bit silly or not necessary, and I'll explain to you why I think it is. My very first experience with the Department of Health and Mental Hygiene, or any exposure to it, was long, long before I was ever involved in politics. I was at my fiance's house, and her roommate, I think, was a dental hygienist or something like that. I think she was a dental hygienist. And she had a certificate issued by DHMH, and it said, from the Department of Health and Mental Hygiene. And I looked at it, and I cracked up. I laughed and laughed and laughed. I thought, this is hilarious. I'm sure it's a joke. And my wife wasn't sure, and then we did some investigation, and I was very, very certain that this couldn't possibly be the actuality, that they named a Department of Mental Hygiene. But I found out, of course, that I was wrong. But that's, a layperson looks at that, and it takes them aback a little bit. We don't, because we're very much accustomed to it. But to an outsider, it does seem odd. Mental hygiene is a mid-19th century word, and of course it refers to mental health. It's archaic. It's an old-fashioned word. This bill is a very minor modernization, and of course it won't do lots of grand things like expand health care and all these other things that we need, but these minor modifications are also necessary in state government. And if nobody puts in a bill like this, they won't happen. So these housekeeping things are important. This is not without precedent. Last year, this committee voted unanimously to pass House Bill 20, which was Rosa's Law, which went through our code and replaced every reference to, mentally retarded with the word intellectual disability. So this follows very much in that vein, I think. It's just a housekeeping modernization. And, when I was younger, we used to say, my mom, I remember, used to refer to people who had mongoloid syndrome. Of course, now we say Down syndrome, but that's phased out. And it's good that that's phased out. I also have seen old movies where they referred to tuberculosis as consumption. So as society progresses, we change our nomenclature and we change the way we say things, and that's reasonable, and I think this is something that should be addressed. The fiscal note is very small. It's $18,000 from the general fund because they have 4 large, road signs that need to be replaced. Other than that, the bill says that any stationery or anything else like that should first be exhausted before new stuff is printed out. Finally, I went out, and you should have this with you, I went out and got the names of the Departments of Health of every single state. And you see all 50 of them right there. And all of them are named Department of Health or Department of Public Health or Department of Public Health and Social Services. We're the only ones that have Department of Health or any mental hygiene, this archaic word. Now, I understand New York City's department is named that, but of course we're not a city, we're a state. And we do stick out a bit like a sore thumb if you look at this sheet. And I've provided the websites if you want to confirm those independently if you wish. That's really all I have, but I hope you'd give it favorable consideration.
Okay. Any questions for the sponsor of the bill? Thank you very much. Concludes the bill hearing on House Bill 613.